Thank you, Mr Speaker, and can I thank the Prime Minister for an advance copy of his statement. Mr Speaker, if I quote, "And while Scotland, Wales and Northern Ireland have their own systems, we will direct money raised through the levy to their health and social care services." Let me tell you, Prime Minister, that health is devolved to the Scottish Government. The Prime Minister can get his mitts off our health system because the people in Scotland trust the Scottish Parliament and the Scottish Government to run health, and they certainly don't trust the Prime Minister.
Order. Quite rightly, we heard the Prime Minister, we heard the Leader of the Opposition. I expect everybody to listen to the Leader of the SNP, Ian Blackford.
Thank you, Mr Speaker, but when we have an attack on devolution, we have the baying mob of the Tories trying to shout down the voices from Scotland. Mr Speaker, government briefings in advance of the statement on social care told us that this was supposedly a key part in securing the Prime Minister's legacy in office. Well, the Prime Minister is certainly creating a legacy, but it's definitely not one in his vivid imagination. The real legacy of this government is now well defined: a Tory government that blatantly breaks manifesto promises and blatantly breaks international law. And it is very telling that as we hopefully emerge from this COVID crisis, the first act of this Prime Minister is to impose this regressive tax. Because the scandal of the tax hike is it will fall hardest on the young and the lowest paid, the two groups who have suffered the worst economic consequences of the pandemic. Pre-COVID and post-COVID, the pattern is the same, and this government has learnt nothing. Westminster keeps adding to the growing burden that young people face, while stripping them of the benefits that previous generations enjoyed. But, Mr Speaker, the unfairness of this tax hike will be especially felt in Scotland. The Scottish Government is responsible for social care and already funds provisions from existing budgets and tax receipts, including SNP policies such as free personal and nursing care. Mr Speaker, we have done it. And as the Prime Minister well knows, by raising this levy across the UK, the Tories are taxing Scottish workers twice and forcing them to pay the bill for social care in England as well as at home in Scotland. This is the Prime Minister's poll tax on Scottish workers to pay for English social care. Scottish people remember that it's this Prime Minister who said that, and I quote, "A pound spent in Croydon is of much more value to the country than a pound spent in Strathclyde." So can the Prime Minister explain to the people of Strathclyde and people across Scotland why he's now going after the pounds in their pockets to solve a social care problem in Westminster that has failed to fix problems in Croydon and right across England? If their pounds are really of the less value, as the Prime Minister claims, then why are we paying the price? Is the Prime Minister willing to stand up and explain to families in Scotland why we're being hit by another Tory poll tax?
Prime Minister.
Mr Speaker, the NHS is a UK institution and we're all proud of it, and we are proud of what NHS Scotland does as well. And he is completely wrong, Mr Speaker, in what he says about those who pay this tax. The burden falls most heavily on those who have the broadest shoulders, as it should, and it is the richest 14% who pay at least half the taxation. And as I've just explained to the House, there is a massive union dividend of £300 million across the whole of the United Kingdom, and the whole of the UK will find more money for health and social care. And that, I think, is what the people of Scotland will understand.
Andrew Ledson.
Speaker, there'll be millions of